All right, I think we're live here. Hey everyone, it's Dr. David here, and we're going to be talking about why knee pain comes on when standing. Welcome to everybody online here, and welcome to those listening back on the replay. And if you have any questions, if you're listening back on the replay, please drop them in here. We'll get back to them as soon as possible. And for those of you that are online right now, if you could just drop a comment in the chat and let me know that you can hear me. Everything looks good on my end, but I'll always like to get a little confirmation from those of you that are watching. And if you have any questions, of course, jump right in. All right, let's answer the question. So we've got to talk about, let me give credit to the person that commented, and I'll read the comment word for word. This is from Thelma North. She commented on one of our videos. I've linked in the description the comments and the video she commented on. She said, "Hello, doc. I need help. Both knees need repair. Cartilaginous, plus my right kneecap is bad, painful, and the back of my knee gets stiff and weaker. I cannot stand more than 2 hours. Please help. Thank you." I'm so sorry to hear about this, Thelma. This is not a fun situation to be in for sure. But let's break this down. So let me answer the big question first about why knee pain comes on when standing for too long. And then I'm going to get into the more details, the other details about like her cartilage and the kneecap and the weakness and stiffness and all that. Okay, so when standing, let's talk about what happens. When you go to stand up, I'm just going to show you my body here a bit too so you know what's going on. When you go to stand up, you use all your leg muscles to be able to stand. Oh, wait, somebody commented. Thanks for commenting. Hi, Sri Pramad. Thanks. I'm glad that you can see me. Oh, you retracted it. Okay, well, let's keep going here. All right, so when you stand up, you use your muscles to be able to support your body. And the muscles that connect around the knee joint, the main ones are going to be your quads that run right here, the front of your thigh muscles. And then on the back of your thigh, you have your hamstrings, and then you have your calf muscles. And contributing indirectly to the balance of your leg are going to be the glute muscles and foot muscles. So glute muscles are back here, the back of the hip. You have the front of the hip muscles as well. These are called hip flexors. Some of them are shared with the quads. And then down in your feet, you also have muscles in your toes that help contribute to the stability of your knee position. So all of those muscles need to have the same, or I'm sorry, not the same. Let me use a better word. All of those muscles need to have an appropriate amount of strength contributing to what the force is going on at your knee. Said more simply, is each muscle has to have the right amount of strength for you to stand properly and walk properly. And if there's one muscle that's way too strong or way too weak, then it's going to increase pressure somewhere. And the knee joint happens to be one of the places that gets pressure added very quickly. So depending on how severe your muscle imbalance is, meaning how much stronger one muscle is than the other, the most common muscle imbalance that we find is the front of the thigh muscles. The muscles that are right here in the front of the thigh tend to be much stronger than they should be, and it's relative. The muscles that are on the hip, in the back, and the butt area tend to be very weak. The muscles in the feet and ankles tend to be very weak as well, and that big imbalance causes a lot of pressure, a lot of compression at the knee joints. So I've got my skeleton here. Let me use this one instead. You detach the legs so we can hold it a little easier. So you've got the quads in the front, and those quads attached to this kneecap. So if those quads are short and tight, it pulls that kneecap up against that thigh bone, the femur, and starts to rub the cartilage in there a little too much. And that's what gradually over time injures the cartilage right behind the kneecap. So that kind of helps to answer the question that Thelma had. Claire, I see your question. I'll get to it in just a moment. But just to go back to Thelma's question, I lost it. Let me bring it up. Just 1 second. Here we are. So she said the right kneecap is bad, painful, and then the back of the knee gets stiff. Perfect. So in line with what I was saying, when the front of the thigh muscles, the quads, get too short, when we go to stand up and we're using our thighs too much on the front of the thigh, we tend to stand with our knees kind of locked. Because watch, if you just bend your knee a bit, you use different muscles. If you try this at home standing up, as soon as you stand with your knee locked, you use this muscle quite a bit to stabilize, which tends to stretch out the back of the knee joints and cause discomfort back there. Oftentimes, we can get other problems that occur, like a Baker's cyst. You can stretch out ligaments in your knee. It's a bad thing to be locking out your knees. We should always be walking with our knees a little unlocked. In other words, not fully straightened out. This isn't something that people are conscious about all the time, but if you think about the way that you stand, a lot of people stand like this. They'll stand up and they lean, sorry, they lean their body one way, they shift their hips over to the side, and that leg that they stand on ends up locking out a bit. And see how my other knee right here is just a little bit bent? We should ideally be standing with both knees just subtly bent. So I'm not locked out this way, but just a little tiny bit bent. And then ideally we should be firing these muscles just a bit. So if we talked about a percentage amount, you don't need to squeeze your butt muscles 100%, but more like 25 or 50%, just enough to shut off the quads, because there's a reflex that connects the butt muscles to the quad muscles and kind of turns them off. It's called reciprocal inhibition. So this is what I teach in some of my other videos. You can go check out our knee arthritis videos or our knee meniscus videos. I talk about this in depth in many of the videos about how the glutes are related to the quads. And if you get your glutes stronger, it tends to fix a lot of problems. It's not the whole picture, but it's a big chunk of the picture when it comes to excessive knee pressure causing cartilage damage at that kneecap and also in the meniscus right here between the thigh bone and the shin bone. So Thelma, I hope that answers your question. I'm going to start to answer some of the other questions, but if anybody else has any questions related to cartilage damage inside the knee when you're standing, then please chime in. I'm happy to answer it. We got about 10 more minutes here, and then I got to jump over to patient care. All right, Clara, let's answer your question. I have pain in my right knee. I've been diagnosed with onset of osteoarthritis and pain in the back of my left heel. Please, how can these be healed? Great question. And then you had a follow-up. Will my doing aerobics worsen my pains? That's a good question. So onset of arthritis, that means you probably had an x-ray. Usually that's how doctors will diagnose it, and they'll see the image of the bones of your knee bones, and they'll say that the space right here is a little smaller than it should, or sometimes you're looking at that thickening that happens on the ends of the bones. If that's the case, then you've got too much pressure going through your knee joint. It could also be on the back of the kneecap right here. You've got to look at strengthening your butt muscles, your glutes, in order to take that pressure off your knee. If it's just the onset, the beginning of osteoarthritis, you likely have an excellent shot at healing your knee problem without making it any worse and avoiding having bad stuff happen, like a knee replacement surgery or having to get like a meniscus tear or other cartilage damage. But you've got to think about using your butt muscles. Now, in regard to, I'll talk about the heel in a minute, but in regard to doing aerobics, the way you do aerobics is what matters. Aerobics can be good or bad for this type of problem. Just like stair climbing can be good or bad, walking can be good or bad, running can be good or bad, cycling can be good or bad. It just depends on how you do it. All these exercises that I've just mentioned are tools to get your knee joint to move, because in all of those motions, you're going to be doing this to some degree as you go up and down steps, cycle, walk, or do aerobics. But which muscles are you thinking about using? And if you're not thinking about using any muscles in your hips and legs, then by default, you're probably going to be using the quads, which is going to feed into its own strength, which it's already probably too strong if you've got that excessive pressure causing the arthritis. And that's going to increase the pressures inside your knee joint. What you've got to begin to do is use your butt muscles more. So when you go to step up on that aerobic step, you've got to think about squeezing your butt muscle on that leg you're stepping up with. If you're walking, every time you take a step, you should be squeezing the butt muscle of the leg that you're standing on. Every motion that you're looking to do when exercising, Clara, needs to be glute driven. And I mean, you got to get obsessed about this. It needs to be a thing that it's always on your mind, that if you're not using your glutes, you're going the wrong way, because it's that important. I treat it like if you had a heart problem. If you went to the doctor and you were told by the doctor, your heart is there's something seriously wrong with your heart, but guess what? I've got this pill And as long as you take this pill every day, you'll be fine, no problem. Same thing here, Clara. If you use your glutes 80% of the time when you're exercising, walking around in your house, at work, at the store, anywhere you are, you're going to be fine. Your knee problems should reduce. You shouldn't have any pain. Your arthritis, if you took an x-ray, the knee might look the same, but you should feel great and be able to do whatever you want. You've got to take it this seriously using your glutes. If you don't use your glutes enough, you will make the problem worse, because by default, your quad muscles are going to take over and increase that pressure over time. It's just a matter of time before, if you've been using your quads, they're going to get stronger and they're going to be adding more and more pressure to the knee joint via the kneecap or the thigh bone on the shin bone. And it's going to worsen the arthritis as you age. It just takes months to years for it to happen. It doesn't happen instantaneously. I hope that helps, Clara. How do I use the flutes, the glutes? There's tons of videos on it. We've got a video that talks about how to walk with the glutes, how to strengthen the glute muscles if you've got knee problems. You got to go back and look in our videos. I'll see if I can link some in the comments here at a later time. But with all these glute exercises, you should feel, this is key right here. I'm glad you asked this, Clara. You should feel like your glutes are getting tired, or at least like they're working. If you do a glute exercise, like you have the intent, I'm going to go work out my glutes. I'm going to do this exercise to make my glutes stronger. And you're in the middle of the exercise, or you're finishing up the exercise, and you don't feel your glutes working, something is seriously wrong. You missed using your glutes. What you need to do at that time is do an easier exercise, do a lower level exercise. You might even just need to think about tightening your butt muscles while you're sitting in your chair or while you're standing up. It might mean that your glute muscles are just very inactive. In other words, they're like sleeping. They're not ready to work. They're not awake enough to be used when you call on them. When you wake up your glutes enough, then it becomes easier for you to walk with your glutes, to do aerobics with your glutes, to do virtually anything with your glutes. Your quads, chances are your quads are probably very awake right now. And if you go to tighten up your quads, they fire right away. But if you are having trouble firing your glute muscles, then you literally need to spend time learning how to fire your glute muscles right now. And that's going to be the biggest use of your time currently. It is not a good idea to go into these exercises that I just talked about, the aerobics, walking, running, cycling, anything. You should not be doing those exercises if your glutes can't turn on. You don't have conscious control of your glutes. And if you can't fire them individually, some people do fire them, but they both tighten up and they can't make one fire and the other fire apart, then you're not going to be successful when you go do your exercises. All right, Claire, I got just a few more minutes, so I'm going to move on to Sri Praman's comments here. Sri, you said, "Hi, doctor. I had right knee cartilage inflammation in October after doing leg press in the gym. By November the 10th, knee was okay, good. The swelling went away. Now, when I do any weight performing activity, it flares up." Yeah, you've got an imbalance probably. Let's keep going. You have some more comments. "Can you please tell me when my knee shall be okay, like it was okay? I'm doing knee exercise, Cardi 2 tablets, and knee braces all the time. Can I continue my exercise at the gym? I'm currently doing light exercise at the gym and still losing weight. The right knee is but on a spamming mode. Don't know when it will flare up." I'm so sorry, Sri. So you don't trust your knee right now and you can't exercise. That's a common place to be stuck, is where you're trying to exercise, you want to lose weight and do good for your knee, but it flares up every time you go do it. Well, the first comment you said, you're doing leg press. That is a quad dominant exercise. In other words, going back to this explanation that I gave about the imbalance, the quads in the front, those tend to be strong, and because those attach to the kneecap, they'll push that kneecap up against the thigh bone right here and irritate it. And over time, it can become inflamed and swollen. So it starts to cause problems when you're exercising. Now, what's good about your knee, Sri, is that you are not irritated so badly right now that you can do normal activities. You said that it just hurts when you go exercise. So what that means is the cartilage in your knee joint right now is just not in shape enough to tolerate the heavier activities. If you do more gradual exercise, you should be able to increase the integrity or the strength of your cartilage so you can tolerate it. But what you need to be doing right now is exercise that does not flare you up. Leg press is just going to flare you up. A leg press exercise, let me demonstrate. For those of you that don't know, I'm going to tip the camera here just a bit. You're in a machine usually, and you're kind of lying back, you're seated. There's a platform that your feet go on, and you're pushing your legs this way, and it makes you use these muscles quite a bit, which is what I've just talked about. They're the quad muscles. You don't want to be using those too much because you're going to feed the imbalance. You're going to make the muscle imbalance worse and increase that pressure at your kneecap and inside your knee joint. So you want to stay off that exercise. You got to go back to firing your glutes. There's machines in gyms like donkey kick machines. We've got tons of exercises here on our channel that talk about how to use the glutes and ways to use your glutes. It's not just about doing exercises for the glutes. It's about getting obsessed with firing your glutes, with walking and doing your everyday things, getting up out of a chair, getting out of a car using your glutes, just standing around at the store. You should be tightening your glutes a little bit, not so much that people notice, but just there should be a little bit of tension going through just so that you're using your muscles properly and you're shutting off the muscles that shouldn't be working. I hope that helps, Sri. Let me answer the next part of your question. When will you be okay? It really depends on how severe it is. You know, you're telling me over a comment here, based on what I'm reading, it sounds like it's not too severe. If you flare down, it took you about a month to flare down, then or at least a few weeks. It sounds like it's mild to moderate. It's not too bad. What you should do is gradually go back into the gym, focusing on glute exercises, and make sure that you don't overdo it. In other words, that you pay attention as you're exercising, and as you exercise, you should not feel any knee pain. And immediately after you exercise, you also should not feel knee pain. If you do, then the exercise was too much for the current level of your cartilage. It doesn't mean that you'll never be able to do that exercise. It just means that your cartilage is not thick enough, not hardy enough, it doesn't have enough integrity or strength to put it through what you're putting it through. It needs to heal a bit more, and you need to do more gradual exercise to make it thicker and hardier so that you can tolerate that exercise. Let me see what else you said here. Sounds like you're doing everything else right. You just got to wait. Cartilage takes time to heal. Without seeing you in person, Sri, I can't give you specific time frames, but typically here in the clinic for a mild to moderate cartilage injury, like it sounds like you have, I'm telling people it's going to take 3 to 6 months before you feel very confident in your knee. But you should be able to heal 100% as long as the damage isn't too much and you're not in your 70s yet. And even then, if you are in your 60s or 70s or beyond, you should be able to heal quite a bit. You just may not be at 100%. You might have very creaky knees, but you should be able to do quite a bit. All right, I'm told I have just a bit more time here, and I have some more comments, so I'm going to just keep going here. Shirley Muna. Hi, Shirley. You said I can stand on my feet and do stuff for hours, and I'm fine. No pain, but once I sit and rest, it's painful to get back up. Yeah. I'm so sorry. Let me just read the rest of the comments here because I may be able to answer a few of them all at once. MCL, Yojana Singh. MCL, how many days should I rest? Baker's cyst, what should I do? Okay, and then Alan Madeira Metz. Are squats good for OA, for osteoarthritis? And then he asked, you have squats in your glute exercises, so I guess they are good for OA. Yeah. Okay, let me come back to Shirley's question. Shirley, you probably just don't have a high, you have a high pain tolerance. You don't feel the pain right away when standing. Some people have a lot of sensitivity. If you feel it more when you sit down, then it means it's probably a cartilage problem. That's usually what happens. Tendons and ligaments and muscles tend to hurt while you're doing the activity. Some people that are just more sensitive, they're more aware of what's going on in their knee. They'll feel the cartilage pain immediately while they're standing or during the standing. And it could also just be that your cartilage is not that bad. It's more of a mild injury to the cartilage. So that's why you feel it when you go sit down. Now, based on you feeling the pain when you go to get up after sitting, that does tell me that you have an imbalance with where the quads are too strong. That's a very common sign. If you've been sitting, those quads shorten. So just to show you on the skeleton here, when you sit down, your knee bends like this, right? Foot's right there, kneecap's right there. It actually stretches the quad because of the attachment from the kneecap here, and it presses the kneecap into the thigh. And if you have a low level of irritation at that kneecap, and then you sit down and that quad stretches and that kneecap gets compressed, when you go to stand up, it feels achy and uncomfortable. So it goes back to that imbalance. You got to start walking around with your glutes, and you just got to use your glutes better. That should help you out quite a bit. For an MCL, Yojana, you've got to take 2 to 4 months on the medium end. If it's a full rupture, you got to go longer, and you need to be using a knee brace. You have to use a knee brace for an MCL injury. Any ligament injury, MCL is a medial cruciate ligament. There's ACL, PCL, and LCL. Those are the big 4 ligaments of the knees. You need to be in a brace that has brackets on the side so that your knee is stable and it's not going to wobble side to side, so you can reduce the clicking or the popping. You're welcome, Shirley. Shirley commented, thank you. Oh, and Sri also commented, thank you. You're welcome, Sri. All right, I got time for one more. Squats and OA. This is a great question. Squats are excellent if you're using your glutes properly. Just to bring it full circle, I made a big rant about how glutes are so important and how running could be good or bad. Leg presses can be good or bad. There's so much to how you move. If you are not using your glutes properly while you move, you're going to increase the pressures at your knee. That's just a fact. So when it comes to squats, Alan, squats can be done in a way that you're using your glutes more. And just to show you, if you're at home right now, you can stand up and you're okay with doing this as long as it's not going to make your knees worse. Just try this. If you squat, just do a little baby squat. You don't have to go all the way down. If you just do this right here and hold it, if you can tolerate going lower, then fine. If you move your knees out like this and shove your hips forward, let me show you what it looks like from the side. Knees out, hips forward, you should feel these muscles working. But most people don't squat like this. They stick their butt out back that way and their chest comes down this way, and then they feel these muscles working. If you're squatting like this, you're probably feeling the tension going through the quad muscles. That's an incorrect squat. It's going to increase the pressures right here. It's just a matter of time before you start to aggravate that cartilage behind your kneecap, the pressures on the meniscus as well. But as soon as you tuck that butt in, you get your hips forward and you open your knees, you force your glutes to work more, which offloads the knee joint and saves the cartilage and the meniscus inside your knee. It makes squats now a healthy thing for you to do because we're human beings. We're bipedal. We walk on 2 feet. We have to be able to squat down to get to our feet, to pick up stuff from the ground, to care for others. It's just a necessary part of being a fully functional human. So I hope that answers your question, Ellen. Ooh, let me see if I can knock out one more question here. Joe Santos, I'm 61 years old, diagnosed with grade 3 osteoarthritis. I'm sorry, Joe. I cannot straighten my left knee. What can I do? Is there a chance to straighten this? It depends. It depends on what you tried, if how severe it is. Grade 3 it sounds like a moderate to severe. If have you tried a stretching routine? Have you tried exercise? Are you more sedentary? It just depends on what you've done. If I were you, I would be looking up exercises to stretch out the knee. We've got tons in our channel here. If you look up our playlist for knee pain, arthritis help, you'll find lots of help for stretching out your knee and seeing that it gets its full range of motion. Now, if you have too much degenerative changes inside your knee joints, in other words, the smooth surfaces inside the joints, if they've become rough and you got a lot of grinding in there, then there's a chance that your knee just won't improve much more because you have a physical block inside your knee and it's just not going to move more. In that case, then you probably might not gain more motion. Then you've got to look at how much motion you've got. If you have enough to walk without a limp, and get up and down from chairs and out of vehicles, then you might be able to get by just fine without having a knee surgery. But if it's enough to where it's making you limp, it can cause you some serious problems. It's going to cause problems in other joints. In some cases, it is good to go get a knee replacement surgery, but you've got to do your due diligence. You've got to try everything that you can naturally. We just actually recorded a video on this, so watch out for it to be coming out in about a month or so, that talks about what things you can do if you've got knee arthritis. All right, guys, with that, I'm going to cut it here. Thanks so much for chiming in. All of you that commented and dropped questions, we'll circle back and see what are the ones we missed and try to answer them. Excuse me. If you're watching on the replay, drop your comment in here. Drop your comment on here, and we'll get back to it as soon as we can. I'm choked up with all the comments. Thank you guys so much. I appreciate you all very much. Give us a like and please subscribe if you haven't already. We'll see you guys in the next video. Bye-bye.